We are live. We are live. Welcome everybody. Today is what is today? Wednesday, the 20th, August 20th, 2025. And changing it up this week. As you know, I'm that healthcare guy. So a little bit about me, and I'm not going to really go more about me, but as that healthcare guy, I give you everything hustle, leadership, grind, a little bit of sprinkle of motivation, but also I'm super passionate about healthcare, the impact that we can make, the people in the organizations that are game changers doing different and better things to help ensure that our health is in the right place and we're getting the outcomes that we're looking for. So there's someone that I've been stalking for quite some time. Her name is Andrea Dietze. I'm going to bring her to the stage. We're going to introduce her and find a little bit more about her business and the impact that she's making. But I'm super excited to bring this guest to the stage. So let me read a little bit about her background first. But you need to understand this. Medicine only works if it reaches the right patient. And that's why I was super excited to bring Andrea to the stage. So a little bit about her. Let me pull up her bio really quick. Where's my mouse? There we go. Oh, I can't even get it right. There we go. So Andrea Dietze, she's the founder of GotMeds. It's a concierge-style prescription delivery service based in Atlanta, Georgia. And her passion is to serve local seniors and vulnerable community members. And it inspired her to launch the 501c C3 nonprofit and is dedicated to improving access to prescriptions as well as healthcare. The impact and the mission statement is clear. We are a not-for-profit organization, and every delivery we make is one less missed dose, one more day of better health, and one more person of not feeling lost in the system. So with that, let's put your hands together. Let's welcome Andrea Dietze to the stage.
Hi, thank you so much.
Hey, you, how you doing?
I'm good. I'm really good. I welcome this opportunity. I'm so happy that I'm here today.
Listen, I'm happy you're here too. I know you and we've been connected behind the scenes, but we've been discussing this for, I would probably say, probably what, 6 weeks at least, that this has been a work in progress.
Oh yeah, so definitely
yeah, it's definitely been a work in progress. And, we finally was able to make the time where we can feature you and spotlight your business. So did I get your bio right? First, let me start there.
Yes, absolutely. We've been working on this for a very long time, and we all have mothers or seniors that need a little bit of help, and it's just people just don't want to go to the pharmacy anymore. It's a rough show at the pharmacy, and unfortunately, things are getting missed. Patients are getting missed medications. 1 in 5, the CDC says, are missed medications or not even started, so abandoned prescriptions. So that's what we're trying to alleviate, and we just are people helping people. We're just a touch point for these patients.
Okay, so we know the goal is we're trying to alleviate seniors missing their medications, right? But before we dig all the way into that, and I read a little bit about your background, but personally introduce yourself to the rest of the world, Andrea.
I'm Andrea Dietze. I live in Atlanta, Georgia, and I've been the founder of this not-for-profit trying to eliminate misdosing and trying to make these patients not feel lost in the system. They just need to make sure they get the right medication at the right time for the right diagnosis. And that's kind of it. I'm here to launch it.
Let's go. So listen, if you're just now joining, I want to make sure the chat box is open. And being that this is a live, you can ask your questions real time. And as they come in, we'll try to filter through them. But it'll be nice if you can drop your first name, where you're from, what state or country that you're from, and then where you're seeing this, because we're streaming across YouTube, we're streaming across Facebook, and then we're streaming across LinkedIn as well. And if you're just now joining, we have a very special guest who goes by the name of Andrea Dietze. She's the founder of GotMeds. It's a concierge-style prescription delivery service based out of Atlanta, Georgia. And her passion is to serve local seniors and vulnerable community members, and it inspired her to launch this 501c3 nonprofit. And it's truly dedicated to improving access to prescriptions and healthcare. And the impact and mission is extremely clear. They're a non-for-profit organization, and every delivery that they make is one less missed dose, one more day of better health, and one more person that's not feeling lost in the system. So Andrea's kind of introducing herself. She's talking about her goals and her missions. Talk to me about Concierge Scripts. Like, what's at the heart of your business?
Well, basically, I saw my mom was just getting a little pushed around in the systems, and refills weren't getting done because she couldn't get into the portal. My mom's in her 80s. All these patients are getting older, and they can't go when you say go into the portal, they don't even know what that means. So it just kind of touched me and inspired me. Like, wait a second, what do these patients do? They can't go into the portal. They can't access. They can't call because they're put on hold forever. They don't get anyone. They don't. It's just a mess. And so I just wanted to alleviate that and try and I've set up my patients with Emory's portal. This is in Atlanta, with Emory's portals and WellStar, just to make it easier for me to access in order to help them out, make sure that they're getting the right medication as prescribed. And the day supply, like there's just questions with day supply and quantity limitations per insurance, and there's just a lot of questions that they don't understand. What it was written for 90. What do you mean? So I'm not a doctor. We are not medical staff, but we're the auxiliary kind of people that just kind of can dig in. This is what your insurance, do you want to call your insurance company? They can maybe better prescribe because we don't make pricing. It's all per guidelines of your plan. So, and it's just kind of explaining to having a conversation. The pharmacist is too busy. The technician's also too busy taking calls and new prescriptions. So it's just basically, I'm a touch point. I'm a human, and I can talk and go over things with them, and just so they better understand.
I agree with you. I mean, when someone tells me, "Hey, you can just log in a portal," I'm like, "Okay, what? One, where's the portal? Two is what is my login? Because you got to remember all these freaking different passwords and everything, and then your fingerprint, scanned eye, retinal, the whole nine. You're like, okay, but as a senior who's not used to all this technology, it's even more daunting. Exactly. And so you came in here and you created Concierge Scripts. So walk me through exactly how it works.
Basically, I'm a phone call away. They call, they leave a message, or if I'm with someone or I'm in the pharmacy, I do work at a local pharmacy, so that gives me a little access a little bit. I'm a certified pharmacy technician, have been for a very long time, but I kind of have access to prescriptions, inventory, stuff like that. But they call, they leave a message, I'll call them back in, a few hours, and I usually set up an initial visit to really go in and kind of dig into what they are needing.
Pause really quick. I'm getting some reverberation back, and I just want to do you hear that on my end?
Yeah, I hear it. Oh, that's it. Is it gone?
Let's try it again.
I don't think it's on my end.
Okay, try it again. Let's go ahead.
I think that's maybe on your end. Are you hearing me?
Yeah, I hear you fine. There's just a little bit of reverberation, and I'm not seeing where it's coming from.
Is that better?
Let's try it. Let's go with it.
I'm not hearing anything. I'm hearing my voice okay.
Okay. Well, listen, it's technology. We're dealing with streaming technology. Not all of it's perfect, but we're trying to make it out as clear as possible.
Yeah. So I set up an initial visit, kind of go over what we're going to need 90 days, 30 days, and the scope of what my position would be with that patient. I'm just a warm kind of director of the operation, not a pharmacist, not a doctor, but I can direct things to where they need to be.
Okay. Let me try to clean this up really quick. That's so strange. I've never had that happen before. Sound like somebody's just ripping up paper in the background. Let me see. Check one. Okay. No. Okay. I just want to make sure it's cleaned up so people can really understand you. Okay. Let me remove myself really quick and come right back. Okay, can you hear me?
Yes.
There's still that feedback, which is interesting. Okay. Okay. Check one, check one. All right, let's keep going. But you was talking about what's at the heart of your business. So what I'm interested in knowing is this is not going to work because this. All right, do it again. There we go. Nope. Sound like it's on my end, which is weird.
Yeah, I think so because I don't hear anything. Do you hear me clear? Yeah.
I can hear you clear. Okay, bear with me. See if we can get this straightened up for you. I need an audio visual technician. There we go. Nope. Okay, check one, check one.
Oh,
I think it's better.
that sounds good.
It's better. I'm not sure what I did, but it's better. But anyway, so we still want to, we still got time for you. We were talking a little bit more about, Concierge Scripts, what's at the heart of your business. Let's start that over again because I want to be clear that everybody really understands what's at the heart of your business. And I mean, actually, walk me through it. Actually, how it works is
how it
what
works,
I wanted to get at. Yeah.
Okay, as I said previously, I do work at a local pharmacy, and what I've seen the problem, originated with my mom, and then I got a little more deeper into it, and I thought, what about these big $1 million script drop, these other providers that are providing, Amazon's doing mail order. There's a lot of people trying to get their hands in it, and unfortunately, the wait times are forever. They can't get an answer with their pharmacist. They can't reach the doctor. There's a mass just problems across the board with these. They need to go to the portal or they need to do the app for script drop, I think, and there's another DoorDash, I think, does it as well. So, and those are just kind of delivery services. There's no kind of interaction with the patient. It's a drop in the mail, similar to mail order, or a handoff. And so I'm just thinking that these patients need a little bit more to understand what they're going on. If they have questions, just a phone call away. Your pharmacist, CVS, Walgreens, wherever they fill, they can call. Always get a pharmacist. Always. You'll have to wait probably, but you'll wait and get your answer that same day. If you need to speak with a doctor, I can put a call in for you, and I usually get, my success rate is pretty good. So, because I know the lingo, I know what I know what I'm doing, and I've been doing this a long time. So, I can alleviate problems, and I just I thought there needs to be a human touch to this, and not making them like they're just a number, because they're not.
So if I'm taking this back to understand this, and I want to make sure it's clear for everybody else who's listening and watching to this as well. If a senior or family member was needing medication for their loved one or themselves, they would reach out to you, and you can coordinate with the pharmacy to get that prescription and actually make sure it's delivered to them. Is that what I'm understanding?
Yeah.
That's okay. So that's crystal clear. I'm getting it now, and I think other people get it now, especially without the reverberation that was going on my end. So help me understand this. How would a family member go about connecting with you in order to use your services like that?
Okay. Yeah. Well, I am local in Atlanta right now. Nobody's doing what I'm doing. Actually, I don't think that there's really. There's just isn't. I don't know why people don't. How doctors and how pharmacists, how anybody can see that there is no problem with these programs, these systems and apps that are in place, but they can just reach out. I'm working on the website. I built it a long time ago, so it just definitely needs work, but all the information is the same. They just make a call, and I will do my best to call them back in a couple hours. I talk to children. Children usually, reach out to me if their parents are having problems. People don't know the complexity they don't understand the complexity of pharmacy. You just count pills. Unfortunately, that's not really the case, but so it can be complex, and with new prescriptions, and it can be very gray. And I'm kind of I can be like the facilitator and make sure that the quantity's in stock, patient gets the medication, no problem.
Okay, so I just added your website to the bottom of the scrolling banner so people can see it. There's www.conciergescripts.com, correct?
Yes.
So www.conciergescript.com. You can go directly on her website, go behind the scenes and see the services that she provides. And you were talking about, so what I'm interested in knowing, because this is really interesting model. It sounds like you're almost a pharmacist, but you're adding the DoorDash piece of it, and now they get it straight to their house. So, I mean, who doesn't want home delivery, especially when it comes to medication, if I'm saving time and expense? So help me understand, like, what inspired you to create this company?
Just basically what I saw in the community, that there was no kind of help for these seniors, that there is family, there are children, but they don't know, they're too busy with their children, or there's just multiple areas that just people just slip, I've seen it over and over and over. It's just too much, I'm, you know what, I was like, I can do this and I can fix this, and so I'm just doing it one patient at a time.
Okay. So help me understand some of the pitfalls or misconceptions in the prescription and the pharmacy world that you operate in.
It's just as far as how fast can things get done.
Yeah, I guess, overall, but from a prescription standpoint, that how fast can things get done? How they actually get their prescriptions? You're talking about the portals. Any misconceptions that comes along with your business? Maybe even service and family members, or some of the misconceptions that you had to deal with when they reached out to you and they have all these various questions. Some of these questions that you go about answering, and how do you go about
Well,
answering?
yeah, absolutely. Some things are clinical. I cannot answer them, but as far as quantity limitations, that I can answer. I can answer a lot. Or we can reach out to the on the portal, because no doctor call. You don't call a doctor's office. You don't go to the ER. You don't. I mean, not at times. Yes, ER is the answer, only option.
Sure.
But overuse of ER, extravagant. So you want to try and avoid that. I try and direct patients to really go about it the right way, because then you will get the best answer. You don't want to flood this. I mean, the system is really flooded. So you don't want to really kind of call and overcall and, multiple, trying to reach somebody with a question. Put the question to the pharmacist or to the doctor, and it will get answered. And I kind of can facilitate that, where it needs to go, or who needs to be asked, or maybe if the ER, or maybe an urgent care. I try and gauge how serious the issue is and gauge it appropriately.
So what if the medication hasn't been scheduled yet by their physician? Can you help out with that, or you only help out once the prescription has already been prescribed?
Yeah, no, I've run into that as well, because the patients can't go on the portal. So what do? You go on the portal. What does the pharmacy do? The pharmacy reaches out. Sometimes, I mean, the system it's new. eScribe. There's a lot of new technology being brought in. eScribe also, there are errors, unfortunately. So we got to call on it, get a clarification. One what? 1 15-gram tube, or one gram. So that it's all that those are the complexities that we deal with, and that's okay. We just got to call it to make sure insurance is going to pay for it, and then it's a reimbursable prescription, so it needs to be correct. So if the patient can't get refills, they need to assure that they have had their annual visit. They need to assure that they have an upcoming visit. There's certain things that need to be in place, because the doctor is not going to call in a maintenance medication if they haven't seen the patient in 3 years or 2 years, whatever. So that's what happens. And patients like, what do you mean nothing's changed? Unfortunately, maybe it has, and you don't know.
Right.
So unfortunately, if that was the case, then people would be on the same medication forever, but they're not.
So if you're just now joining, we've partnered today with Andrea Dietze. She's the founder of GotMeds. It's a concierge style prescription delivery service based in Atlanta, Georgia. And her passion is to serve local seniors and vulnerable community members. And it inspired her to create this 501c3 nonprofit, which is dedicated to improving access to prescriptions and healthcare. And she's on impact. She's on a mission to change the way seniors and loved ones receive their medication. So she wants you to think of it kind of like a DoorDash for medications, and she can help you with that communication between the physician and the pharmacy to ensure you're getting your medications delivered in a timely amount, so you don't have to worry about logging into a freaking portal and trying to figure out what's my login, and then reaching back out to your physician or the nurse to figure out how you can get in touch with identifying and understanding more about your medication. So this is great. I want to understand more about, you said there's not a lot of people that's doing this. So what is your different and better story?
I guess we just know, like, my team of who I work with. I've worked, and because I'm in the pharmacy, so I kind of have a connect with other. When I go into other pharmacies, I can either give the, because I deal with sometimes a mania patient or something, and I'm like, and as unfortunately, I know it can be done because
Right.
I work. So if I'm dealing with a patient like that who needs their medication just like that. So, I'll go in and I'll say, I'll maybe give the pharmacist a little kind of, not like, listen, we got whatever the medication is usually like, maybe antipsychotic or something like that. And so I'm just kind of, let's rush this, and I don't want to go in front of anyone else. I don't want to do that. But when
Yeah.
we have someone, it may be a police incident, it may be something, it may escalate to something that none of us want to deal with. So
I have
I
I have a burning question. So if I'm new to your site and I log into your site and you and I were able to get connected and I have, some medications that need to be picked up, from the time that I reach out to you, how long before I can actually use your and benefit from your services?
Depending on where you're located, I'm local in Atlanta, so depending on where you're located, usually on maintenance medications, or everybody varies so different, so widely. There's a pain medication, or there's a inflammation medication. Patient is in pain, so they need it that day. As far as like an Eliquis prescription, an anticoagulant, those usually they're refills. So we usually set those up, I'll see you in 28 days, or, we just kind of line it up like that. But I filter in new patients as time allows. And usually it's going to be same day.
Right.
But when I can get there is depending on where they're located.
Got you. So I know there's a burning question that I want to know, and I'm sure other people want to know as well. And it's where the buck stops. Like, how do people pay for your services?
I'm a 501(c)(3). I started this as a donation kind of operation, and basically people understand the need, the necessity, and that some people cannot pay. I have background things going on. I have a website, I have gas, I have insurance. There's just a wide range of operational fees that come in to this. So, partners with foundations, grants, but donations from my patients are really what's keeping us going right now. And we are a 501(c)(3), so a tax receipt is given at the end of the year.
So basically, I can reach out to you, benefit from your services, and don't have to pay anything, but you're relying on funding from other organizations and just, I guess, out of people's hearts that help fund your program, so you can help other people as well.
Right, because of what I can do for patients, and they've seen, and as I said, my success rate, I can't even believe. I'm shocked. Sometimes I'm shocked of what I actually, like, just like that. I get it done, and I'm sometimes shocked at what I can do. So I just they'll pay because they're impressed with what I can bring to the table, and assure that their parents are taken care of.
So I know you're in the Atlanta metro area, and it seems like you have a very dope. This is like a dope business concept, and I can see this truly expanding and growing from here. Is there any aspirations of expanding outside the state of Georgia?
Oh, absolutely, absolutely. Because this need it's blown my mind. It's just blown my mind, and that people, bring you food and bring you, but it's delicate because we're protected under the laws of HIPAA, and that's what laws are put in place to protect. So it would need to be in an envelope, and it would be more pharmacy technicians would really be the only people, or pharmacists, or doctors, which probably don't have time to do this kind of thing. But
Right.
doctors have done it too. Doctors have delivered medication, to their patients as well. But you really have to have a medical knowledge base to really talk about. I can call the insurance. I can find out the quantity limitations, or there's certain things that you just need to know moving forward. About hiring, about growth, absolutely. But there is a need, but to find the right people will probably be a challenge.
Right. Okay. So knowing that there's aspirations and there's an opportunity for you to grow outside the state of Georgia, let me ask you this. Are you open to like outside fundings or open to partnerships that can help create additional opportunities to help expand that growth?
Yes, absolutely. I'm open to all, like, like-minded. You kind of need to understand, and people understand. It's all over. It's everywhere. You've heard about over the overuse of. There's just everybody knows what's going on, but
Yeah.
there aren't a lot of people that are actually doing anything about it.
Okay. And so, I would say, I wouldn't say it's my final question, but as we're wrapping up here, how can they connect with you? I know right now at the bottom, we have your name streaming. We know you're the founder of Got Meds, and there's the website on there as well. Is there additional ways that connect with you as well?
I mean, my phone number is the best number to set something up. An initial visit with your parent or initial visit with you, because I have because sometimes the parent there's cognitive decline in the older patients. They don't understand. I could be saying that I'm going to come today. They hurt tomorrow, or So I kind of want to nail a child usually down, and we can discuss the needs of the patient. And my phone number is the best because I will call you back, and
Okay.
it doesn't just go to some call center somewhere. It's me. So
Are you fine giving out your phone number on air?
absolutely,
Go ahead, give
I'm
it out.
looking for I'm looking for growth to help as many people, because really, no one is doing what I'm doing, and these patients are slipping, and I don't like to see that.
Go ahead, give out your phone number, and I'll put it here in the chat as well.
My local Atlanta number is 678-358-0270.
Okay, it
That's
should be
not many.
358-0270. You see it at the bottom of the screen. You tap in with Andrea, not now, but right now, especially if you're in the Atlanta area and you've been struggling with that whole process of, okay, I just came from the physician's office. They prescribed me X and X medications, but they want me to go through this portal so I can log in, so I can download my information, so it can be sent to the pharmacist. And so now I can go to the pharmacist to pick up my medication. But today we've connected with Andrea Dietze from Got Meds. And what she's telling us is that, you know what, scratch all of that. We can save you some time. There's a service that she provides through her nonprofit. And it's a dope service that not a whole lot of people know about. And she's interested in growing this outside of the state as well. Andrea, let me open up the mic for you really quick, because I want to give you 30 seconds just to look in the camera. Tell people anything that you want them to know about you, your business, and the outcomes you're trying to make here.
Just basically, I want to help the people that feel like they're forgotten. I know this kind of jogs someone's memory, I'm sure, of a time that they didn't understand something in the pharmacy, or they felt rushed, or they felt like they needed a little bit of help and no one could help them because there wasn't enough staff, or, people, that sounds familiar, I'm sure, to a bunch of people, or they've heard the story, or that. So I just wanted to let you know that there is help, and that I've got meds. You're not going to run out of your medication. You're going to get it. Got meds.
Love it, love it, love it, love it. Listen, medicine only works if it
If
reaches
you get
the
it.
patient. And Andrew
Exactly.
wanted to make sure that I drove that message home with you guys. So once again, let me read her bio so you know a little bit more insight about Andrea. Andrea Dietze, she's the founder of Got Meds, a concierge style prescription delivery service based in Atlanta, Georgia. Right now, her service area is Atlanta, Georgia metropolitan location. But she's super excited about not only the impact, but expanding across various regions, states as well. Her passion is to serve local seniors and the vulnerable community members, and it inspired her to launch this 501c3 nonprofit and is dedicated to improving access to prescription and healthcare. Connect with her, not now, but right now. Her information is streaming right there across the bottom. Andrea Dietze, founder of Got Meds. It's www.conciergescripts.com. Phone number 678-358-0270. Let's give her some love, because the impact she's making is huge. It could be you or your family member. So until next time, let's keep grinding, let's keep hustling, and let's keep making an impact. Andrea, I thank you for your time today, and I appreciate the work that you're doing behind the scenes.
Thank you so much for allowing me here to discuss my meds.
Awesome. Make sure y'all tap in with Andrea, not now, but right now. Her LinkedIn is open as well. She's on LinkedIn. You can connect with her on her mobile number, but she's available to service your needs. Until next time, thank y'all for joining. This has been another LinkedIn Live. Let's go.
Thank you so much.